This short training module will provide you with an introduction to the Evac123 patient evacuation system and assist you in developing an understanding on how to use the system for effective patient evacuation. Evac123 is not intended for NICU, PICU use. Effective evacuation is comprised of three fundamental components. The first component is room evacuation, which consists of moving patients from their rooms to a pre-designated staging area. The second component is transportation, which consists of utilizing available resources to transport patients to destination facilities. The third component is the destination's confirmation that the patients were successfully received. Evac123 provides a simple tool set for each of these components to optimize the patient evacuation process. The yellow 1 tool set is for the room evacuation component and contains evacuation tags and corresponding receipt holders for the tag's yellow receipt. The evacuation tag itself is comprised of two portions. The patient portion that is placed on the patient contains patient-specific information which tracks the patient through the evacuation process. The door portion, which will be affixed to the patient's room door, indicates the patient's movement status. The back of the door portion has an adhesive strip for affixing to the door, while the patient portion contains an S-bar documentation area and transport mode indicator. Optimally, a label that identifies the originating facility should be placed on the tag prior to being placed into service. Performing this task in advance will speed the evacuation process and ensure destination facilities know where the patient originated from. Evacuation tags should be placed in the patient's chart so they are readily available in the event an evacuation is ordered. Additionally, 4 patient labels should also be placed in the chart to accompany the tag. Tags placed in service may be reused when the patient is discharged. When an evacuation is ordered, place the patient labels on the tag's 4 receipts. If labels are not used, handwrite the required information onto each of the receipts. During an evacuation, separate the tag along its vertical perforation and indicate any relevant information on the patient portion of the tag. Then place it on the patient using the tag's pre-strung cotton string. Next, expose the adhesive strip of the door portion of the tag and affix it to the patient's room door. Rooms with multiple patients will have multiple door portions. Finally, indicate the patient's mobility status and room number on the tag. Mobility status is a function of the resources needed to move a patient. In general, patients with the least resource requirements will be moved first. The mobility figures on the door portion provide visual indicators for which mobility type of patient resided behind the door. As patients are evacuated, remove and retain the yellow door portion receipt. The receipt should be placed in the receipt holder for organized accountability. Confirm all patients have been evacuated from a sector by ensuring no yellow receipts are visible on the doors. A door portion with the receipt attached indicates the room is not cleared. Patients brought to the designated staging area are sorted or triaged based on the resources needed to move the patients. Highly ambulatory patients have low resource requirement, whereas moderately and non-ambulatory patients will require greater levels of specialized transport and care. When determining how and where to transport patients, utilize the best practical assignment of patients to available transport vehicles, the destination facility's care capabilities, and the number of beds available. Also, consider the current stability level of each patient and any isolation or other special medical care needed. As patients are loaded for transport, remove the tag's blue transportation receipt and place it in the transportation log located in the Information written in the transportation log assists in patient and equipment tracking and fulfills the HICS 255 form requirements for patient evacuation. Upon arrival at a destination, remove the purple receipt and place it in the destination log located in the Evac123 purple number 3 toolkit. Each known destination facility should have a number 3 toolkit in advance. Send a receipt holder with the driver if a facility is not so equipped. When a destination facility notifies the originating facility a patient has arrived, use the transportation log to indicate the time of the confirmation. Also, indicate when the family is notified of the patient's new location. This ensures full HICS 255 compliance. So, in summary, during an evacuation, the tag is first split, with one portion being placed on the patient and the other to the door. As rooms are cleared, the yellow receipts are removed and retained. At staging, the blue receipts are removed prior to transport. And once a patient arrives at a destination, the purple receipts are removed. Evac123, the solution for effective patient evacuation.